Well, earlier in the week, Nigeria joined the rest of the world to commemorate the World Hand Hygiene Day with a message that just a few seconds of hand washing can save lives. The Nigeria Center for Disease Control led this advocacy here. And now that the day is over, just how much impact will it have in reducing the rate of COVID-19 infections? Not forgetting the challenges of access to potable water and sanitizers and the rest. Well, Dr. Tochi Oko joins us this evening. She's the Infection Prevention and Control Program Coordinator at the NCDC. She joins us from our Abuja studio. It's great to have you on the program, Doctor. I know it's World Hand Hygiene Day, but shouldn't it be World Hand Hygiene Year? I mean, because this is quite important. So how much really can a day like this achieve, especially for something very vital and continuous?
Yeah, thank you very much for having me. Indeed, it should actually be World Hand Hygiene Century. Every day should really be dedicated to hand hygiene. But you know, one particular day needed to be singled out to make a solid push, a solid coordinated push all over the world to begin to make that strong case for the value of hand hygiene. But every day at work, every health worker is expected to use hand hygiene as a very effective but low-cost intervention to ensure both patient and health worker safety.
Right. Now, that's important. But now that the day is over, what next, really?
We marked it on the 5th of May. So even though the day is over, the work hasn't stopped. And actually for us at the Nigeria Center for Disease Control, it's been an ongoing engagement, an ongoing endeavor. And our mandate, as you know, is to safeguard the health of Nigerians. And part of the ways we are working towards achieving that mandate is through the work we do in our antimicrobial resistance and infection prevention and control program. You know, antimicrobial resistant organisms, that is, those things that antibiotics could take care of in the past, it's beginning to be a big problem all over the world. And then you come and add on to it the problem of COVID-19, you begin to appreciate the scale of the problem. So for us at the Nigeria Center for Disease Control, we realize the very important position that infection prevention and control occupies in the prevention of every infectious diseases, and especially also in the prevention of disease outbreaks. So since 2019, we have actually been working both nationally and at subnational with health facilities all over the country to establish strong systems of infection prevention and control. And one of the key bedrock of those systems is hand hygiene. So what we have done is over the years, we have been building the capacity through the training of health workers all over the country on how to strengthen the ability and the capacity for hand hygiene.
Well, you must have noted some of the challenges faced by people, healthcare workers, in some of these interactions you've had. So what are the major challenges, really? Because, I mean, there will not be any need for a day off for sensitization if hand hygiene, hand washing was not a problem in the first place. So what are those major challenges to ensuring, you know, full coverage hand hygiene and the solutions?
Thank you very much, and that is a very good question. The challenge is really, I like to look at it from the individual perspective, then look at it from the tasks that individuals need to do, and then we look at the system issues. First of all, individuals need to understand and have the knowledge of exactly how to perform hand hygiene. So you notice that most people think that in healthcare, that hand hygiene is just something you can do anyhow and how you like. But there's actually a system, a technique, and a duration of time that a health worker needs to take to make the hand safe. And that is why you see in this year's hand hygiene slogan, seconds save lives. Because you need to make your hands safe at least if you're using alcohol hand rub, you need to use it between 20 to 30 seconds. And if you're washing your hand with soap and water, you need to do it for at least 40 to 60 seconds. So that is the duration. And then there are specific techniques that health workers need to understand. That step-by-step techniques that needs to happen coupled with the time duration. This is what evidence has shown, that when a health worker does it that way, it makes the hand safe. So knowledge on the part of health workers is a problem. Then we do have attitudinal problems. A lot of health workers, because of lack of knowledge, and sometimes also because of the workload and other behavioral challenges, really have the attitude that hand washing or making the hands safe through hand hygiene does not matter. And then we look at the system issues. The water, sanitation, hygiene infrastructure in our health facilities can also be a challenge. Also issues around funding. Therefore, in addressing hand hygiene, we are just not looking at it from one perspective. We are looking at it from multifaceted viewpoints. While we are getting health workers trained and building their capacity, we're also advocating for policymakers, for managers of health facilities to make the infrastructure available for health workers so that knowledge on the part of health workers, good attitude on the part of health workers will be supported by those system change things that need to happen.
Right. Well, I do hope that by next year, when we commemorate another World Hand Hygiene Day, some of these challenges would have been resolved at the various levels. But we'd like to thank you so much, Dr. Tochi Okwo, for sharing your thoughts with us on the program.
Thank you very much.